Hello, welcome to Anatomy DAHAR series again. Today's topic is Pectoral Region. Diagram based the upper limb lecture. It includes practice questions at the end. Text slides number 2 to 31. Practice questions slides 32 and 33. Color code of the text. The basic anatomy must know in light yellow color. Clinical highlights good to know in light red colors. Fine points for the advanced readers bold in light blue color. Illustrated, prepared and presented by Dr. Abdul Hamid Abdul Rashid. Pectoral Region Introduction. What is pectoral region? The word pectoral comes from the Latin word pectoralis, means breast or chest. Pectoral region is therefore the region of the breast or the chest. In gross anatomy, the first part of the human body usually introduced to the freshly joined Year 1 medical students is the upper limb. That begins with the pectoral region. Hence, the teaching of the anatomy of the upper limb takes part early in medical schools, just after the students learned biology in pre-medical, the foundations years. Therefore, the students are very often do not have enough prerequisites to deal adequately with the pectoral region so early days of the first year. Because of that, I would like to introduce the prerequisites needed in the pectoral region first, before we deal the main topic. The repeat readers can skip prerequisites if not needed. Pectoral region prerequisites. Aponeurosis. In Greek, it means white, flattened, tendinous expansion. Brachium. In Latin and Greek, the word brachion means the upper extremity or the upper limb. Cervical. In Latin, it means neck. Corpus means body. Costa. In Latin, rib. Plural ribs are called costae. Costal cartilage means cartilaginous part of the rib. Cutaneous, above the skin or dermis. Dermatomal area, an area of the skin supplied by one spinal nerve. Intercostal, between the ribs. Mid-clavicular line, an imaginary vertical line comes down from the midpoint of the clavicle. Plexus in Latin is braid, meaning woven thread or a network. Network of nerves, network of veins, or network of lymphatic vessels. Ramus, branch. Plural, rami. Sagittal, vertical plane parallel to the median plane of the body. Prerequisites. Thoracic cage seen from in front. So this is the anterior surface of the thoracic cage. Let's see the structures. Number 1, clavicle, also called collarbone. This is scapula, just behind and below the clavicle. These are the ribs. More than one we call costae, just one we call costa. This whole thing is called sternum or breastbone, which is divided into 3 parts. The uppermost part is called Manubrum sternum. The middle part is called corpus sternum, that is body of the sternum. The lowest part is called Xiphi sternum. Between the Manubrum sternum and corpus sternum, there's a joint is there. We call Manubro sternal joint. also known as sternal angle, because if you do the surface marking along this one, there's some angulation is there called sternal angle. What is important about this sternal angle is, if you do surface marking, lateral to the sternal angle is the costal cartilage of the second rib. So if you feel the sternal angle, you know that lateral to the sternal angle is costal cartilage of the second rib on each side. From here, you can count down, that means third rib, fourth rib, fifth rib, etc. So it is important to be surface marking. Next is mid-clavicular line. We have already mentioned this is an imaginary vertical line coming down from the midpoint of the clavicle. So this is called mid-clavicular line. Next is anterior mid sagittal line, that is along the midline. This is the one, anterior mid sagittal line. How many segments are present in human spinal cord? This is the diagram of the human spinal cords. You can see many segments here. The spinal cord is externally unsegmented, but the human spinal cord is considered to be divided into 31 segments. Each segment is named according to the numerical number. What are they? 8 segments in the neck, cervical region, C1 to C8. 12 segments in the thorax, T1 to T12. 5 segments in the lumbar region, called L1 to L5. Another 5 segments in the sacral region, that is S1 to S5. And 1 segment in the coccygeal region, coccygeal 1. A total of 31 segments in human spinal cord. Each segment gives a pair of nerves called spinal nerves, one on each side. Prerequisites: cervical and brachial nerve plexus. You can see here there will be 8 cervical spinal nerves in the neck, cervical region, and 12 thoracic nerve in the thoracic region. So C1 to C8 in the cervical, T1 to T12 in the thoracic region. First to fourth cervical nerve, that is C1 to C4 spinal nerves, formed a cervical nerve plexus on each side of the neck. So C1, C2, C3, C4 will form cervical plexus on each side. Fifth cervical nerve to first thoracic nerve, that is C5, C6, C7, C8 and T1 spinal nerves form the brachial plexus on each side. So in this place, C5 to T1 will form the brachial plexus. Second thoracic to 12th thoracic, that means T2 to T12 spinal nerves, do not form any nerve plexus. So you will see in this diagram, cervical nerve plexus, which is formed by first to fourth cervical nerve. Brachial plexus is formed by C5 to T1 spinal nerve. Below that, from T2 down, the spinal nerve is not forming any plexus. Prerequisites: what are the parts of each spinal nerve? This is the segment of the spinal cord. Each segment on each side give one spinal nerve. Let's see the diagram. Each typical spinal nerve consists of 4 parts. Number 1, 2 roots coming out from the segment. Okay, these 2 roots will join together and form a trunk. The trunk will divide or split into dorsal ramus and ventral ramus. The ventral ramus is the intercostal nerve, which is important. Ventral ramus will give two main branches. One is lateral branch and another one is anterior branch. Lateral branch will supply the thoracic wall lateral to the mid-clavicular line, and anterior branch will supply the lateral wall medial to the mid-clavicular line. Prerequisites. Branches of the typical spinal nerve in the thoracic wall. This is the continuation of the previous diagram, but simpler form. In this diagram, we have imaginary coronal plane, which is dividing the thoracic wall into anterior half or anterior part of the thoracic wall and posterior part of the thoracic wall. This is the spinal nerve, which gives dorsal ramus, which goes backwards, and ventral ramus, which goes lateral and forward. This ventral ramus is the intercostal nerve. It gives two main branches. This is the lateral branch of the intercostal nerve. This is anterior branch of the intercostal nerve. This is mid-clavicular line. So, anterior wall of the thorax medial to the mid-clavicular line is supplied by the anterior branch of the intercostal nerve, but anterior wall lateral to the mid-clavicular line is supplied by the lateral branch of the intercostal nerve. Prerequisites. Branches of the intercostal arteries through the thoracic wall. This is the cross sections of the trunk. In this diagram, there's additional line is here. This is imaginary coronal plane is here, which divides the thoracic walls to anterior part in front of this line and posterior part behind the line. This is thoracic aorta, which gives a pair of intercostal artery at each level. This intercostal artery accompanies the intercostal nerve. Each intercostal artery will give posterior branch and anterior, which runs lateral and forward. So this is intercostal artery. It gives a branch, a lateral branch here, big one, which will divide, split into two. One will go behind, one will go in front, and also give continuation here. That is the anterior branch of the intercostal artery. This is the lateral branch. This is the anterior branch of the intercostal artery. If you see in front part, this is anterior mid sagittal plane or sagittal line, and this is the sternum. On either side of the sternum, we have another artery coming down called internal thoracic artery, also known as internal mammary artery, which comes down on the lateral side of the sternum, and it gives branches. One goes laterally, small one, and the one goes in front. This is called perforating artery or perforating branch. This is mid-clavicular line. So the area, that is anterior part of the thoracic wall, between the anterior mid-sagittal plane and mid-clavicular line is supplied by branches from the internal thoracic artery. That is here, perforating artery, and this little branch going laterally, they will supply this part. But the part of the anterior wall of the thoracic, this is the mid-clavicle line. The part lateral to the mid-clavicle line is supplied by the lateral branches of the intercostal artery. So this area is supplied by these branches. This area is supplied by these branches coming from the lateral branch of the intercostal artery. Pectoral region. The word pectoral derives from the Latin word pectoralis, means the breast or chest. I've already mentioned earlier. Two pectoral regions, right and left, each is located at the upper part of the chest, between the root of the neck above, lower margin of the rib cage below, side of the sternum on the medial side, and the anterior fold of the axilla, that is the armpit, on the lateral side. So the pectoral region is between the root of the neck, lower margins of the thoracic cage, sternum on the medial side, and the anterior fold of the axilla on the lateral side. Usually, the pectoral region, which is the first part of the upper limb, is the earliest topic in cross anatomy to be introduced to the new medical students. The students are very excited, especially during the dissections, as they are exposed to the cadavers for the first time, asking every tiny thing, and the lecturers have to answer without ending. Actually, the pectoral region has not much clinical importance other than the breast with the mammary glands, its blood supplies, and lymphatic drainage are located in this region. The main structures in the pectoral region are muscles. They are covered by the skin, superficial fascia, and deep fascia from superficial to deep. Number 1. The skin of the pectoral region received cutaneous nerves. Cutaneous means about the skin, dermis. Number 2. The superficial fascia, the second layer which is deep to the skin, it consists of number A. Cutaneous nerves. They are supraclavicular nerves, anterior and lateral branches of the intercostal nerves. B. Superficial blood vessels, arteries and venous plexuses. And C. Lymph vessels. The upper part of the superficial fascia over the clavicle is light red stained. It consists of fibers of a thin subcutaneous muscle, the platysma. It descends from the lower part of the face up to the level of the sternal angle and the second rib below. The mammary gland is developed in the superficial fascia in females and will be presented separately. Look at the diagram first. We can refer the slide number 4. This is the line, the level of sternal angle and second ribs. We have already mentioned in the slide 4. And this is the vertical line, that is anterior mid sagittal line. And these two red lines are mid-clavicular lines, right and left. This is the area between the anterior mid-sagittal line and mid-clavicular line. This is the area lateral, that is behind the mid-clavicular line. Now we are going to talk about the cutaneous nerve supply. Number 2A, cutaneous nerves in superficial fascia. Small 1, the supraclavicular nerves, cervical 3 and cervical 4, are branches from the cervical nerve plexus in the neck. Refer slide 6. They supply the skin of the upper part of the pectoral region up to the level of the sternal angle and the second ribs. You can see here upper part of the pectoral region above this line, that is up to the line level of the sternal angle and second ribs. The intercostal nerves are the anterior continuation of the spinal nerves that run between two adjacent ribs. Each spinal nerve gives anterior and lateral branches. You can refer slides 7 and 8. Small 2. The anterior branches of the intercostal nerves supply the skin between the anterior mid sagittal line and mid-clavicular line. These are the branches, anterior branches from the spinal nerve will supply this area. Number 3, this area, the lateral branches of the intercostal nerves will supply this area that is lateral posterior to the mid-clavicular line. Note, the first thoracic T1 nerve does not give cutaneous branches to the pectoral region. Furthermore, C5, C6, C7, C8 and T1 nerves form the brachial plexus and are carried to the upper limb. They do not provide cutaneous nerves to the pectoral region. Therefore, the cutaneous nerves of the pectoral region are supraclavicular nerves coming from third and fourth cervical, supplied to the uppermost part above the sternal angle and the level of the second rib, and T2 to T6, that is second thoracic to sixth thoracic spinal nerves to the part, supply the part below the level of the sternal angle. Hence, dermatomal areas of fourth cervical and second thoracic come close to each other with no other cutaneous nerves in between. Thoracic cage, anterior surface, because we are looking from in front. Few structures we are going to highlight. This is right clavicle, left clavicle. This is lateral half of the clavicle. This is medial half of the clavicle. This is sternum or breastbone. Uppermost part is called manubrum sternum. The middle part is called corpus sternum or body of the sternum, and the lowest part is xiphisternum. These are costae or ribs. These are cartilages of the ribs called costal cartilages. See the diagram. This is the upper end of the right humerus. This is anterior. This is head of the humerus, number 1. This part is called greater tubercle on the lateral side. Greater tubercle on the lateral side. This is lesser tubercle on anterior side. Between the two tubercles, there is intertubercular groove or sulcus, also called bicipital sulcus. So that is between the two tubercle, intertubercular sulcus. This part is lateral lip of the intertubercular sulcus. This part is medial lip of the intertubercular sulcus. So, this is head, this is greater tubercle on lateral, lesser tubercle on anterior. Between the two is intertubercular sulcus. This is lateral lip of the sulcus. This is medial lip of the sulcus. Muscles of the pectoral region. They are the main structures of this region. The pectoral region consists of 3 muscles deep to the deep fascia. They are pectoralis major muscle, pectoralis minor muscle, and subclavius muscle. They are arranged in two layers. The pectoralis major muscle is anterior layer in front. The pectoralis minor and subclavius are in deeper, the second layer, behind. In addition to these three muscles, a thin layer of muscle, the platysma, is in the superficial fascia, that is outside the deep fascia. Number 1, pectoralis major muscle. This is the pectoralis major muscle. Look here, it is the main muscles of this region, triangular in shape and flat. Pectoralis major muscles consist of two heads, that is two parts. Number A, the clavicular head, clavicular part, and number B, sternocostal head or sternocostal part. Proximal attachments of the clavicular head. Number A, this area, proximal attachment or origin. The clavicular head arises from the medial half of the anterior surface of the clavicle. That is, this clavicular part of the pectoralis major muscle is arising from the medial half of the anterior surface of the clavicle. If you look at this diagram, this is the clavicle, looks from above, medial end, lateral end, anterior border, posterior border. This is medial half, this is lateral half. This pectoralis major muscle, the clavicular head, is arising from the medial half of anterior part of the clavicle. This is the thing. Pectoralis major muscle. Continuation. The second part, sternocostal head of the pectoralis major muscle. Its proximal attachment, that is the origin. Look here, this is manubrum sternum, body of the sternum, copper sternum is here. This is upper 6 costal cartilages are there. The origins of the sternocostal head of the pectoralis major muscles arises from the lateral half of the anterior surface of number 1, manubrum, number 2, body of the sternum, number 3, upper 6 costal cartilages, and number 4, the aponeurosis of the external oblique muscle of the abdomen. That is the flat tendon from the external oblique muscles of the abdomen. If you see this diagram, you will see muscle fibers vertically coming down on the medial part of the sternocostal head of the pectoralis major muscle. See, very rarely vertical muscle fibers are present superficial to the medial part of sternocostal head. This is the one. It is called rectus sternalis, thoracic counterpart of rectus abdominis. Look at the diagram again. This is greater tubercle, this is lesser tubercle. Between these two tubercles, there is a groove or sulcus there called intertubercular sulcus. This is the lateral lip of the intertubercular sulcus. This is medial lip of the intertubercular sulcus. Now let's talk about the insertion, that is the distal attachments of the pectoralis major muscle. Pectoralis major muscle is inserted by bilamina, that is two layered of flat U-shaped tendon to the lateral lip of the intertubercular sulcus, to the lateral lip of the intertubercular sulcus. Fine points. The clavicular head is inserted by the anterior lamina, anterior layer of the tendon, into the lateral lip of the intertubercular sulcus. The fibers coming from the manubrium are also inserted by anterior lamina to the lateral lip, but deep to the clavicular fibers. The lower fibers coming from the sternocostal part and from the abdominal aponeurosis are inserted by the posterior lamina, posterior layer, to the lateral lip of the intertubercular sulcus. That means bilamina, 2 layers of insertions. Anterior layer and posterior layer. In anterior layer, most superficial is coming from the clavicular part, and deep to that clavicular part is the fibers coming from the manubrium. Again, deep to those things, still inserted to the lateral lips, are fibers coming from the sternocostal and abdominal part. So all are attached to the lateral lip of the intertubercular sulcus, but in 2 layers, bilaminar insertion. The pectoral fascia. It is a thin layer of deep fascia that covers the anterior surface of the pectoral major muscles, attached medially to the sternum, above to the clavicle, and laterally with the axillary fascia. Actions of the pectoralis major muscle. Pectoralis major muscle is a powerful adductor and medial rotator of the arm. The sternocostal fibers are the chief adductors. The clavicular head assists in flexion at the shoulder joint. With the upper limb fixed in abduction, the muscle acts as an accessory muscle of inspiration, drawing the rib upwards towards the humerus. Thus, for the clavicular head, the arm is abducted to 90 degrees or more, and the patient pushes the arm forwards against resistance. For the sternocostal head, the arm is abducted to 60 degrees and adducted against resistance. The contracting head can be seen and felt. Clinical highlights. The lateral border of the pectoralis major muscle formed the anterior axillary fold, that is, anterior wall of the axilla, armpit. In the congenital absence of the pectoralis major, there will be the absence of the anterior axillary fold. What may happen to the fractured clavicle? Look at the diagram. This is the clavicle, this is fractured, and this is medial part, and this is lateral part. Lateral part is attached to the coracoid process by coracoclavicular ligament. Medial part is attached by sternocleidomastoid muscles. The lateral 1/3 is attached by trapezius muscle. When the clavicle is fractured, medial to the attachments of the coracoclavicular ligament, medial to the attachment of the coracoclavicular ligament, its 2 fragments are displaced in different directions corresponding to the muscle pull. The medial segment of the clavicle is displaced upwards due to the pull of the sternocleidomastoid muscle. The trapezius, which is attached to the lateral 1/3, is unable to support the weight of the arm. The lateral fragment is drawn downwards because of the weight of the arm, and medial, that is drawn medially by the shoulder adductors, They are pectoris major muscle and teres major muscle. This leads to the overriding of the two fragments and the shortening of the clavicle. The second muscle of the pectoral region is the pectoralis minor muscle. Let's see the diagram first. This is the costae, that is ribs. This is third ribs, fourth ribs, and fifth ribs. And these are the costal cartilages of these ribs. This is coracoid process. If you see coracoid process, this is horizontal part of the coracoid process, this is vertical part, and this is the apex of the coracoid process of the scapula. So, pectoralis minor muscles, it lies deep to the pectoralis major muscle. A proximal attachment, that is the origin. Pectoralis minor muscles arises from the outer surfaces of the third, fourth, and fifth ribs, outer surfaces of the third, fourth, and fifth ribs near the costal cartilages. B. Distal attachments, that is insertion. Pectoralis minor muscle is inserted to the medial border and the upper surface of the horizontal part of the coracoid process of the scapula. Actions of the pectoralis minor muscle. It is an accessory muscle of respiration. The upper end is fixed and the lower fibers raise the ribs during respiration. It assists the serratus anterior muscle in the protraction of the scapula. It keeps the lateral, that is glenoid angle of the scapula, anterior and inferior, closed to the chest wall. Fine points. Relations of the pectoralis minor muscle. It is the key muscle of the axilla. Anteriorly, it is related to the interpectoral, that is rotus lymph nodes, and pectoralis major muscle. Posteriorly, it is related to the second part of the axillary artery and axillary vein and cords of the brachial plexus. Lower, that is lateral border, is related to the lateral thoracic vessels and an anterior group of axillary lymph nodes. Third muscle is the subclavius muscles. Sub means beneath, clavius means clavicle. That is the muscles beneath the clavicle. Let's see the diagram here. This is the first rib and this is its costal cartilage. This is clavicle. We are looking the inferior surface of the clavicle here. This is the right clavicle, medial end, lateral end, and this is the inferior surface, middle third of the inferior surface of the clavicle. There is a groove there called subclavial groove. So shallow groove is here. Now let's talk about the subclavius muscle. It is a small muscle located above the pectoralis minor muscle but deep to the pectoralis major muscle. Its attachment, proximal attachment, that is origin. It is originated from the junction between the first rib and its costal cartilage. Junction between its first rib and its costal cartilage. This is the origin. Then where will be insertion or distal attachment? It is inserted to the subclavian groove, that is the inferior surface, middle third of the inferior surface of the clavicle. So subclavius muscles is attached to the subclavian groove in the inferior surface of the middle 1/3 of the clavicle. This is insertion. Actions of the subclavius muscle. It stabilized the clavicle in movements of the pectoral girdle. It may prevent the jagged ends of the fractured clavicle from damaging the adjacent structures. Brachial nerve plexus. This is prerequisite. The final one is in another chapter. See the diagram first. This is called lateral cord of the brachial plexus. This is posterior cord of the brachial plexus. This is medial cord of the brachial plexus. We want to know about three nerves, from where these three nerves arises from the brachial plexus. This is number one, lateral pectoral nerve. It arises from the lateral cord of the brachial plexus. Remember. Next is medial pectoral nerve. This is the one. It arises from the medial cord of the brachial plexus. Number three, nerve two subclavius. This is we call upper trunk of the brachial plexus, also known as a Erb's point. So nerve two subclavius arises from the upper trunk, that is the Erb's point of the brachial plexus. Nerve supply to the muscles of the pectoral region. All three muscles, pectoralis major, pectoralis minor and subclavius, received nerve supply from the brachial plexus. Just now I have already shown you. Now let's see the diagram here. This is the clavicle. This is pectoralis major muscle in front. This is pectoralis minor muscle and subclavius muscle. They are in the second layer deep to the pectoralis major muscle. Both pectoralis major and minor muscle, pectoralis major and minor muscles are supplied by number one, lateral pectoral nerve, which also gives branch to this one, to the pectoralis minor, and medial pectoral nerve. Both of them comes from the brachial plexus. Lateral pectoral nerve arises from the lateral cord, and medial pectoral nerve arises from the medial cord of the brachial plexus. Just now I have already mentioned. The subclavius muscle is supplied by nerve to subclavius, which comes from the upper trunk, that is the Erb's point of the brachial plexus. Fine points. Let's see the diagram first. This is clavicle. This is pectoralis major muscle. The upper part is clavicular head. The lower part is sternocostal head of the pectoralis major muscle. Deep to it, this is pectoralis minor muscles. This is subclavius and this is clavicle. The fascia between the subclavius and the pectoralis minor muscle is the clavipectoral fascia. This is lateral pectoral nerve, comes from lateral cord of the brachial plexus. It runs forward, pierces through the clavipectoral fascia and supplies the clavicular head of the pectoralis major muscle. As it comes forward, it gives small twigs which will come and join the medial pectoral nerve and supply the pectoralis minor muscle. This is medial pectoral nerve, which arises from the medial cord, comes forward, pierces through the pectoralis minor muscle and supply that muscle first before it proceeds forward to the sternocostal part of the pectoralis major muscles and supply that part. So both pectoralis major and minor muscles are supplied by lateral pectoral and medial pectoral nerves. Fine points. Continuation. The lateral and medial pectoral nerves are so named because they are originated from the lateral and medial cords of the brachial plexus respectively. The pectoralis major muscle is the only one in the upper limb to be supplied by all 5 segments of the brachial plexus. C5 and C6 supply the clavicular head, and C6, C7, C8 and T1 to the sternocostal head. Nerve to the subclavius is a branch of the upper trunk that is from the Erb's point of the brachial plexus. Clavipectoral fascia. Look at the diagram first. This is pectoralis major muscle. Deep to it is pectoralis minor muscle. This is clavicle. Below the clavicle is subclavius muscle. Clavipectoral fascia is a strong facial sheath filling the space between the clavicle and pectoralis minor muscle. This is clavipectoral fascia. Above, clavipectoral fascia splits to enclose the subclavius muscle and is attached to the edges, that is the lips of the subclavian groove on the undersurface of the clavicle. It is mentioned in the lecture on clavicle. Laterally, clavipectoral fascia is attached to the coracoid process on the lateral side, and medially it blends with the external intercostal membrane. Clavipectoral fascia continuation. Look at the diagram. This is clavicle. This is subclavius muscle underneath the clavicle. This is pectoralis minor muscle, and this is clavipectoral fascia. Clavipectoral fascia. At the lower border of the subclavius muscle, the 2 layers of the fascia fuse and form a transverse band, the costocoracoid ligament. This is the subclavius muscle. 2 layers of fascia fuse below the subclavius muscles and form a transverse band called costocoracoid ligament. Costocoracoid ligament. This is the one transverse band. It stretches from the first costochondral junction, that is first rib and its costal cartilage junction on the medial side, to the coracoid process on the lateral side. That is medial extent and lateral extent of this costocoracoid ligament. Inferiorly, clavipectoral fascia splits to enclose the pectoralis minor muscle. Below the muscles, the 2 layers of fascia unite and extend downwards as the suspensory ligament of the axilla. So 2 layers surrounding the pectoralis minor muscle will fuse again and form the suspensory ligament of the axilla. Inferiorly, this suspensory ligament will be attached to the axillary fascia over the floor of the axilla and maintains the concavity of the axilla. This is axillary fascia. This is the suspensory ligament of the axilla, which is formed by 2 layers surrounding the pectoralis minor muscle. Structures passing through the clavipectoral fascia. Let's look at the diagram first. This is clavicle. This is subclavius. This is pectoralis minor muscle. Between this pectoralis minor muscle and subclavius, there's a fascia we call clavipectoral fascia. The clavipectoral fascia is pierced through by 4 structures, 2 passing inward and 2 passing outward. 2 passing inward are lymph vessels and cephalic vein. This is the cephalic vein which is coming inward. And 2 passing outward are the lateral pectoral nerve. This is the one, lateral pectoral nerve, LPN, and thoracoacromial artery, TAA. So lymph vessels and cephalic veins will go in through the fascia, lateral pectoral nerve and thoracoacromial artery will come out through the clavipectoral fascia. Fine points. The lymphatics are from the infraclavicular nodes to the apical nodes of the axilla. The cephalic veins is the superficial vein of the arm drains into the axillary vein. They enter through the clavipectoral fascia. Lymphatic vessels we cannot see, and this is the cephalic vein. This is a superficial vein on the lateral part of the arms. These 2 cephalic veins and lymphatic veins will go through the clavipectoral fascia. Next is thoracoacromial artery. This is the thoracoacromial artery. It's the second branch among the 6 branches of the axillary artery. The lateral pectoral nerve is a branch of the lateral cord of the brachial plexus. We have already discussed this one. It supplies the clavicular head of the pectoralis major and give a twist to the pectoralis minor muscles. They go out through the clavipectoral fascia. The end, illustrated, prepared and presented by Dr. Abdul Hamid Abdul Rashid. Now is the good time to subscribe to our Anatomy DAHAR series channel. You will be notified as soon as our next video is available to you. Anatomy DAHAR series also provide other videos related to the present topic. Thank you for watching.